I'm going to take a deep dive here. Okay, you all ready for this? Because I'm going to give you guys, I'm going to be a teacher for a second, and I'm going to educate you on some important terms. So what you're looking at is a kind of a GIF file. It's an image that plays out as a kind of a movie scene or a video. But what you see is kind of a working model, a theoretical model in a way that takes two constructs, executive function and self-regulation, right? And it takes these two constructs and it shows how they relate. It is the best model that I've seen out there to encapsulate the work that our what goes on inside their heads, right? With the cognitive process. So what we do is we kind of get stuck in the behavioral aspect of things. Oh, my kid is disorganized, right? My kid can't tell time. But what I want us to take a minute to is I want you to kind of look under the hood, and I want us to look cognitively at what's going on, okay? So the stimulus is the input of information. The information comes in, right? It gets, you have kind of that automatic response that can play out with certain responses. With an ADHD child, that might look like the hyperactive impulsivity that may play out, right? And we see that, it's okay. As they get older, as they get more mature, as they learn skills, it's less impulsive, because what ends up happening is you have a stopgap. There's a point in time in their cognitive processing where they catch those thoughts and they filter that through the blue section. Make sense? And information comes down through the red section, right? And then it gets caught. So instead of responding, it gets caught. Some type of awareness, some type of moment. Maybe it's a social pressure, but I'm not going to call out in the middle of class anymore, right? I'm going to raise my hand. So I'm not going to blurt out answers what I might have done. I'm going to catch that thought and I'm going to filter it. I'm going to filter it through an intentional self-regulation process. It's that intentional self-regulation that gets their child to their frontal lobe, thinking and evaluating and planning. Got it? It's in that time, it's in that space where they're using their executive function skills, their executive function processes. And then they make a deliberate action based on that process. Okay? So this is just a really cool model to understand that executive functioning or executive function skills do not take place in isolation, right? Where we have to start is in self-regulation skills, right? We have to start there and teach our kids how to catch those thoughts, how to catch that thinking, and how to then apply deliberate attention, deliberate cognitive processes, planning, decision-making, problem-solving, reflecting, evaluating in order to make a decision, okay? So there are three cognitive processes that typically play out as being part of executive functions. And again, there are so many theoretical models out there, parents, right, that I get overwhelmed with them all. Every time you read something, there's a different interpretation of executive functions. I'm only talking about the cognitive processes. I'm not talking the behavioral ones, the ones that are observable. I think you all know enough to know that what those might be. Disorganization, right? Poor time management because you see them scattered. Right? There's all these kind of symptoms of the executive dysfunction. I just want us to look at it from a working memory standpoint, which is significant. It's not talked about enough. The other one is inhibitory control, which is really self-control, right? How do I manage my thoughts and impulses in a deliberate way, right? That's that kind of that red to blue area, right? And then cognitive flexibility. How do I evaluate and switch gears, transition? We kind of see it as a rigidity sometimes, or a stubbornness, but really that can play out as more of a cognitive skill gap around being able to see different solutions to a problem. So I get rigid in my thinking because I see the one solution that may not be the best one, but it's the one I see, and that's the one I want to stay with. Right? Okay, so there's these cognitive processes that play out. So in self-regulation, so Albert Bandera, you don't have to know who he is. He's just a guru of self-efficacy, but he's also one of the leading researchers in self-regulation theory. And he talks about self-regulation in 3 domains, really, around monitoring, judging, and reacting. So I monitor, I judge my behavior based on internal and external variables, and then I react. Self-regulation, I say in our work too, that we do self-regulation coaching. Why? I want to coach my student, my client, coach them to get better and better at filtering information through their frontal lobe, right? So if I can teach them self-talk strategies, great. If I can teach them breathing techniques, great. I just want to help them to filter information to stay out of their amygdala and to get that information up to their frontal lobe where they can apply logic and reasoning. Now, this would be a time in a classroom where I've just dumped a whole bunch of kind of content on you, and then I would filter questions and answers because I know if you're really into this type of theoretical and content, you probably have a lot of questions that you want me to continue to dig into. But I don't know if that's really the point of this presentation. So I may have to just move through that and maybe take those kinds of questions later, or have a separate presentation on just geeking out on the theories and terminology. But what this means is if I can help my child regulate their thoughts, regulate their emotions through that red section, then I'm going to help them also move into that attentional awareness piece, where that gate, where I help them see the information, see the feelings, or feel the feelings, catch those thoughts, and then consciously apply executive function skills to a problem, which is why we started this lesson with think about a problem, right? I want them to see, but I can't have them solve a problem if they're dysregulated. It's not going to happen. Nope, you're too dysregulated. Your emotions are not allowing you to get into your frontal lobe. Not a good time for us to be problem solving. Go take your time out, come out, and we'll talk when you're calm, right? That's why that 3, 2, 1 timeout, it can last as long as your kid can respond to it. Or I should say 1, 2, 3, right? 1, 2, 3 timeout. So